Assisted suicide should not be illegal, but it may also be within my power to take a life. This awesome responsibility is most to be faced with a great humbleness and awareness of my own frailty. Above all, I must not play God. Hippocratic oath. That's what the doctors do before they sign in or something. When people receive a bad news about illness, they may take a rational decision to die. Assisted suicide is against the oath doctors take to endanger the weak and vulnerable, and it's betrayal to human dignity. Physician-assisted suicide threatens to corrupt the current. Yeah, no, that's not it. Corrupt medications practice, corrupt the profession of medication by permitting the tools of healing to be used as a technique to kill. Fundamentally distort the doctor's-patient's relationship, greater reducing patients' trust in doctors and doctors again. Commitment to the healing of their patients. Create. Yeah, that's it. All right. Stop laughing. The AMA Code of Ethics rejects physician-assisted suicide. The AMA states that physician-assisted suicide is fundamentally incapable with the physician's role as a healer. As law professional Carter Sneed notes, dozens of professional associations and groups representing variable persons oppose physician-assisted suicide, including the World Health Organization, American Nurse Association, Hospice Nurse Association, plus 34 other organizations. Doctors are also trained in palliative care consulting. I'm going to show you what palliative care is now. Palliative care definitions. Palliative care is a specialized medical care for people with serious illness. This type of care is focused on providing relief from symptoms and stress of a serious illness. The goal is to improve quality of life of both the patients and the family. Palliative care is provided by a special trained team of doctors, nurses, and other specialists who work together with the patient's other doctors to provide an extra layer of support as appropriate at any age and at any stage of serious illness, and can be provided along with curative treatment. No, curative. Yeah, that word again. However, compassion is not guaranteed against doing harm. A physician who doesn't know how to relieve a patient's suffering may compassionately but inappropriately agree to kill a patient's life. It is also endangering the weak and vulnerable. Doctors are not trained in palliative care. That word, palliative care consultant in Oregon was underscored by a survey of Oregon physicians who received the first 142 requests for assisted suicide since the law went into effect, and only 13% of the cases of palliative care that were recommended, and we do not know how many of these recommendations were actually implemented. Another issue is insurance companies may find assisted suicide cheaper, alternative, and stop paying health care a lot sooner than what they should be. It is only $300 to get the lethal injection, which is a lot cheaper than actual treatment. Depression doesn't equal death. Patients requesting suicide need a psychiatric evaluation to determine whether they are seriously depressed, mentally incompetent, or for whatever reason do not need the criteria for assisted suicide. Yet only 5 of the 178 Oregon patients who died under the Oregon Assisted Suicide Law in 2013 and 2014 were referred to at any psychiatric or psychological evaluation. Remarkable patients were referred for psychiatric evaluation in less than 5.5% of the 859 cases of assisted suicide reported in Oregon since the law effect in 1997. Most people request the assisted suicide not because of pain, but because of loss of dignity or burden of the family. According to Dr. Paul McCall, Dr. Paul, a professor of psychiatry at Johns Hopkins University School of Medicine and chief of Johns Hopkins Hospital from 1975 to 2001, highlights that with physician-assisted suicide, many people, some not terminally ill, but instead demoralized, depressed, and bewildered, die before their time. It also violates the equal protection of the law of those with disabilities. Assisted suicide shouldn't be legal because it is against the physician's oath of practice. Oh God, how do I go back? Alright. A right or wrong. Leon Cass, a medical doctor, a philosopher, explains that physician-assisted suicide is in fact states of abandonment of its duty to protect innocent life, especially the old, the weak, and the poor. Because of this, I encourage you not to support physician-assisted suicide. Thank you.